And Synflorix is actually, you can start injecting it even 6 weeks onwards. If you do, some people prefer to do their vaccination in private, so the schedule might be a little bit different from the national immunization guideline. Prevena 13 is usually a 4-dose vaccines. Again, it can be injected as early as 6 weeks, but people tend to do it at 2 months, 4 months, 6 months, and the last dose at between 12 to 15 months. Okay. But the dose is quite expensive. I think in private, it can range up to 300 to 400 per injection. Okay. Now we will move on to the next slide. Just a little bit about sites of administration. I will not go in detail each vaccine, but in general, all the vaccines are injected intramuscular, except for a few exceptions. Rotavirus or live typhoid, which is administered via oral route, and BCG is intradermal, usually injected over the left deltoid. When you inject intramuscular route, anterolateral aspect of the thigh is preferred as compared to gluteal side, because the absorption through the gluteal side is not as ideal or as good as the anterolateral aspect of the thigh. So again, I will not go into detail all the side effects of each vaccines, but in general, they are all relatively safe, except for few common side effects, which include local reaction, transient fever, or rashes, especially in the case of MMR. Of course, there's some worrying adverse effect. One of it would be anaphylactic reaction. Hence, this is an absolute contraindication for any vaccine. If you had an anaphylactic reaction to previous dose or to a component of the vaccine prior to that. So a lot of times, parents will question whether if my child having some flu or cough, whether I can proceed with the usual vaccination as scheduled. Again, minor infection without fever or systemic upset is not a contraindication. So if your child do have some flu but no fever, remains well otherwise, you should proceed with the vaccination as scheduled. So what are some popular vaccine myths that I would like to debunk today? Okay, we will go through a few. So the very first number one popular myth would be whether MMR vaccines cause autism. How does this belief came about? Actually, we have to go back to 1998 when Andrew Wakefield and 12 of his colleagues published a case series in the Lancet journal. Okay, they study about 12 children and they come up with these findings of MMR, stating that MMR leading to behavioral regression and also pervasive developmental disorder in children. But despite the very small sample size of 12 children and also uncontrolled design, this journal somehow gained wide publicity and the MMR vaccination rate dropped significantly after the publication of this journal. But eventually, this journal is completely discredited as they found out that a lot of serious procedural error and also undisclosed financial conflict of interest, which is not disclosed. So this journal is subsequently retracted, and because of this, the author actually lost his license. So what is the fact? So MMR does not cause vaccine. Subsequently, there are a lot of research, large sample size, found that the vaccine does not increase the risk of autism and it does not trigger autism in susceptible children and is not associated with clustering of autism cases after vaccination. So what about second myth? Natural immunity is better than vaccine-acquired immunity. It is true in some cases that natural immunity does result in stronger immunity to the disease rather than the vaccination. But you have to think the dangers of this approach actually far outweigh the relative benefit. For example, if you contract measles, you will face 1 in 500 chance of death compared to the number of people who have had severe allergic reaction from an MMR vaccine, which is actually less than 1 in 1 billion. So do your math, whether it is true that natural immunity is better than vaccine-acquired immunity. So number 3, vaccines are actually unsafe. So again, when we talk about safe, what is safe? Safe means that there's no harm from the vaccine, but as we all know, no vaccine is 100% safe. And safe also means that you do not no harm from the disease. And no vaccine is actually 100% effective. But what we all do know is to do nothing is actually to take a risk. So there are some concerns about the use of some preservative, for example, formaldehyde, mercury, or aluminium in vaccines. It's true that this compound, if beyond certain level, it is toxic to our body. But as in FDA-approved vaccine, only very trace amount of this chemical are actually contained in the vaccines itself. In fact, according to FDA and CDC, this formaldehyde is produced even at a higher rate by our own metabolic system. And there's no scientific evidence that low level of all these compounds can actually be harmful to us. So the myth number 4 would be, a lot of parents will say that multiple vaccination might overload the immune system and their baby or their children couldn't cope. Again, scientific evidence show that giving several vaccines at the same time has no negative impact on a child's immune system. And the last one, HPV, perhaps most of us are not very familiar with, is actually nowadays given at 13 years old to female in 2 or 3 doses. Okay, so they do claim that HPV vaccine is associated with autoimmune diseases, but there are a lot of diseases. They studied, for example, Guillain-Barré syndrome, the type 1 DM. So again, there are no study that show that there's association between HPV viruses and autoimmune diseases. So just a list of a few suggested vaccination, which is not listed in our national immunization program. One of it would be rotavirus. It's actually a 2 doses oral vaccine. Usually you can give at as early as 6 weeks old, and the second dose would be at least 1 month after, but before 6 months of age. So pneumococcal, again, is implemented in overseas, but not in our country yet. We do have a lot of a few serotypes also for meningococcal vaccine. Neisseria meningitidis is for that bacteria. So again, most of them are single dose, and it provides immunity up to 3 years, and sometimes you do need booster for that. Yearly influenza, this is one that we strongly advocate for those who have pre-comorbids, especially ex-prem with chronic lung disease. We do encourage them to get yearly influenza virus. Varicella zoster infection, which is commonly taken by a lot of parents in private center now, is actually a 2 doses series, and the first dose will be given at 12 months old, 1 year old. Okay, so now we'll move on to COVID-19 vaccine in children. I'll pass the mic to my colleague, Dr. Aisha.
Okay. Assalamualaikum warahmatullahi and very good morning. Can you hear me? Okay. So I will continue with the last part of our presentation, COVID-19 vaccines in children. So why do we need to vaccinate all our children with COVID-19 vaccine? So children seldom develop severe forms of COVID-19. Deaths from the disease are even much rare still. However, occasionally, kids with mild symptoms can later develop the deadly multi-system inflammatory syndrome in children. And evidence is building that vaccines might block transmission of this virus. So vaccinating children could have a greater impact on the herd immunity. And children and adolescents might soon be contributing more to community spread as more of our adult populations are vaccinated. So how are some of the different COVID-19 vaccines compared? So we have the RNA vaccine, the Pfizer, which most of us had, viral vector, the AstraZeneca with adenovirus, whole inactivated virus, the Sinovac, and also the protein subunit Novavax, which also was utilized in the technology of developing hepatitis B vaccine. Okay. So these are the vaccines acquired by our country: Pfizer, AstraZeneca, Sinovac, CanSino. The latest one is a Sputnik from Russia. So few countries are utilizing this vaccine as well. So COVID-19 vaccine in children. So what's happening worldwide? Early trial result showed that children aged 12 to 15 who received 2 standard doses of Pfizer developed substantially higher levels of virus blocking antibodies than those who aged 16 to 25. There's a study published recently in July. This is actually an ongoing multinational placebo-controlled trials involving about 2,260 adolescents. Half of them actually received the Pfizer vaccine and half received placebo. And among the participants without evidence of previous infection, there were no COVID-19 cases within 1 week after the second dose were noted among the vaccine recipients, while about 16 cases occurred in those who received placebo. So they concluded that it is safe, produce greater immunity response compared to young adults, and it is highly effective against COVID-19 virus. This trial also began testing Pfizer-BioNTech vaccine in children under 12 in late March this year. Also, similar trials run by AstraZeneca in February and Johnson & Johnson in April. However, they paused all trials because there's evident concerns about link to complications of blood clots. So what are problems with vaccinating children? So as we mentioned earlier, we need to strike a balance between triggering the strong immune response and minimizing side effects. And also it's a bit difficult because we need to ensure that this new vaccine is not interfering with the routine childhood immunization that is provided by, especially by our country. And efficacy data will be a bit limited because there might be too few symptomatic infections in children to be studied on anyway. So what's recommended by CDC? Everyone 12 years and older should get the COVID-19 vaccination. What's advocated now at the moment with the current evidence is Pfizer-BioNTech vaccine. The Emirates actually already providing Pfizer for children aged 12 to 15. And they recently rolled out Sinopharm COVID-19 vaccine to children aged 3 to 17 years. Australia has also approved BioNTech Pfizer for children aged 12 and over, especially to those indigenous population and those with underlying medical condition. Germany also joined in to make it available to 12 to 17-year-old. So locally, the National Pharmaceutical Regulatory Agency has actually approved Pfizer-BioNTech for those 12 years and older, in line with the CDC recommendation. However, later on, government agreed not to give yet to those less than 17 as to avoid risk of myocarditis and pericarditis, and waiting for further data regarding this matter. So what are some of the myths about COVID vaccine? COVID vaccine alters DNA. COVID vaccine is not safe because of quick rollout. Breastfeeding and pregnant ladies cannot get this vaccine. You can get COVID-19 from the vaccine. So it's a bit difficult. And also, there's a myth about, okay, once you're vaccinated, you no need to wear mask or social distancing anymore. But in fact, this is not true. We still need to take precaution to help end the pandemic because there's a still risk that we can carry this we can be a carrier for the COVID-19 vaccine. Actually, that is the end of our presentation. So I would like to invite any question from the floor to me or Dr. Luch. Okay. Okay, so there's a question, any role of influenza vaccine in preventing COVID? Okay, so as we know, especially for us healthcare workers, we are encouraged to get influenza vaccine yearly, to prevent us from getting the common flu, influenza. However, these vaccines actually need to be produced. That's the reason why it is needed yearly, because it will incorporate the latest variants of the flu virus. However, this flu vaccine is not preventing you from get COVID. So that's why we need to get one of the COVID vaccine that is specially targeted for the severe acute respiratory syndrome coronavirus 2. So question from, okay, can parents, okay. Sorry. Hi and good morning. Thank you for the very informative talk. My question regarding third dose injection of vaccine is going to be implemented. It's going to be implemented. Thank you. Okay, I assume this is regarding the third dose for Pfizer BioNTech vaccine for COVID, right? So is it going to be implemented? I cannot really answer that question, because the third dose is for the adults lah kan. We are actually actually I read more about vaccination in pediatric. However, there's evidence lah to support, but then we need to wait for further information and further data from the studies. Okay, you want to say something?
So the question just now, I don't think we can answer that now, but some of the country have started doing that. If I'm not mistaken, Israel has started the third dose of Pfizer, but I think our PM can answer that better than us. So the next question, one of you asked if parents can defer some of the routine vaccination in children during this pandemic. So again, there is reason why the immunization schedule is scheduled as such at certain age. And as you notice, during the first year of life, there are a lot more vaccines which are scheduled in the first year of life. Because this is important, because if during infancy period, if they contract those diseases, the implication is big or can even lead to death. But again, during this pandemic, I would say other than COVID-19, other diseases, I mean, they are still around. It's just that perhaps it's less because people stop traveling around and people don't go to crowded places. hence it's less contagious. But I would say you have to judge the benefit and disadvantage. Of course, you can defer, but how long do you want to defer? There's no harm if you defer a month or two, but we can see this COVID pandemic is not going to end anytime soon. So I guess ultimately you still need to vaccinate your child, hopefully not too far apart from what is being planned, and strictly follow SOP. If you can avoid crowded places, maybe wait in the car before your turn, and get them vaccinated. Any more other questions? So we posted an article about impact of influenza vaccine on COVID-19 infection rate and severity. For those who are interested, maybe you all can have a more detailed read about it. Anything else? In that case, we shall call it a day. If you have further question that you don't have time or to ask now, you can always direct personally to us later on. All right, thank you for joining us today. Oh, sorry, there's one last question. If child vaccinated with rotavirus vaccine, any contraindication for them to go for DTaP HIV? I don't think so. Both of them are totally different vaccines, and there's no contraindication. If you take rotavirus vaccine, you can't go for DTaP, Haemophilus influenza B. Rotavirus vaccine, actually, one of the commonest brand will be Rotarix. It is actually just an oral vaccines, 2 doses. Regarding time, any gap? Okay, rotavirus, you can give it as soon as 6 weeks old. And the next dose will be either 4 weeks apart. So if you get your first dose at probably 2 months old, and then your second dose of rotavirus would be at 3 months old, the earliest, or you can give at 2 and 4. So a lot of time when you go to private, most of the time private pediatrician will offer you, and they normally have their schedule in a way that is convenient for you, so that you don't have to go so many frequent visits. So I don't think you have any time gap, because the rotavirus, they do have a specific time when to give, as early as 6 weeks, and the next dose would be at least 4 weeks apart from the first dose. And the DTaP, of course, is follow our national immunization schedule at 2 months old, 3 months old, and 5 months old. So all right, so we will close the question time for the floor. If you have any question, feel free to direct to any of us. Thank you. Have a nice day. The QR code, I'll leave it here for another minute. So those who join in late, kindly scan to mark your attendance. All right, thank you.